Welcome everyone to this interview and conversation, really more than an interview, with an eminent guest, Professor Hugh Montgomery from UCL and other places in London. And what prompted this chat was the fact that we have, of course, Earth Day coming up. Earth Day is meant to focus our attention on something which we should be focusing on all year round, but doesn't always work that way. Today, I wanted to start with a quote from one of our members, McKinsey, who issued a report some time ago which said, if the global healthcare sector were a country, it would be the 5th largest GHG emitter on the planet annually. Now, I've talked to many people in the healthcare sector, and I can promise you now, they do not think that they are polluters. Some get it. The majority say, that must be somebody else's problem. So I think today, remember, this is aimed essentially at our sector and our many communities around the world. So I've asked Hugh to start off by maybe commenting, first of all, on that statement by McKinsey, but then moving on to my usual question, Hugh, is so what? What can we do about it? Is it too late? Can we actually do anything at all? Or are we just good at talking, but not actually at doing? So with that rather haphazard introduction, please, Hugh, over to you.
Well, it's an interesting statistic, isn't it? But the problem is when you start carving things down into small lumps, everyone just uses as an excuse not to do anything. So when you say, well, you know, global healthcare is 5.2% of emissions, everyone goes, oh, well, so 95% comes from somewhere else, and my hospital's a small fraction, and, you know, if it was, you know, it's not my fault, it's whatever, and a pharmaceutical company and a tech company, and whichever hospital is, will blame another hospital. And if you're in England, people say, well, what about, you know, what about China? What about India? Everyone's got some reason for someone else to take any action. And the other thing, I think those sorts of figures with 5.2% of global emissions are rather disempowering, because people say, well, even if we got rid of all our emissions, what difference does it make? So I think we need to reframe these things a little bit in two ways. I think the first is, to answer your first question, is it too late? Almost certainly it is. We are catastrophically past where we ought to be. We triggered 10 or 11 positive feedback loops of temperature. We're triggering a whole load of binary weather state changes. We're in for absolute catastrophe. Is there a chance? Yes, there is. But the only chance we've got really falls into two domains. The first is every single one of us must take responsibility. We live in an age of consequence. And we're all used now to saying, well, it's someone else's problem. Well, it's not. Every single one of us must do what is right and encourage those around us to do the same. Now, could that make a difference? Well, in healthcare, oddly, it could, because the number that's important is not the 5% of greenhouse gas emissions. The number is that we're 11.7% of global domestic product. And if you add in domestic consumer healthcare products, Durex, Dettol, toothpaste, it's a lot more than that. And if you add in social care, it's a lot more than that. And if you add the allied industries and transport and refrigeration and packaging, it's more again. And we don't have to move the entire world's economy in one go. If we moved the entire global healthcare economy, that would probably be enough. It would probably trigger everything else to follow. But we've had almost out of time. We've got to do this right away. So that's the real bit. We've all got to do the right thing in our personal lives and in our professional ones. There is no excuse. And I should actually, by the way, just to warn you, if one person, including you, says anything involving net zero or by 2040 or any of this nonsense or Paris aligned, if you're in the same room, I would have to throw you out of a window because they're all nonsense.
Very interesting approach. Yes, I'm just on the last point, and thankfully we're not in the same room, we're virtual today. But just to say this to you, it's a feeling interesting of I have a couple of grandsons, and one of them who's 22 said to me the other day, he said, what does all this mean about net zero? And I'm quoting him, so I'm not actually saying it myself. But basically, he was puzzled by this sort of intangible, and he said this to me, he said, this is intangible. I want to know what I personally can do and what my company, which he works in, can do. Would somebody just tell me in simple language?
Would you like me to tell you what I think?
Yes, I do, because I want to pass it on to Oscar.
Okay, well, oh, good. And Oscar, my son was called Oscar. It's a good name. So the first thing is that net doesn't exist, and your son is right. It's intangible because it's magical. It's magic unicorns. The idea is you draw down the carbon that you can't stop emitting. But last year, including land use, we released around 41 billion metric tons, and we drew down 1.6 million metric tons because the technology doesn't exist. And the only technology that does exist is called rainforest, and we're chopping them down. You can't plant trees because by planting the trees, they grow, you get about 5.9 kilograms per tree per year, and then they fall down. And if you were to, and rot, and if you were to try to sequester this year's carbon, you'd need to plant around 4 times as many trees this year as there are on the entire planet already. So, and they burn down as they did in California. So your son is absolutely right. It's a nonsense and it's an excuse. People, they would say, well, we're going to be net by insert date here, which is actually just a way of not doing anything. We need to be at real zero emissions, and we need to be at real zero emissions almost immediately and drawing down. Okay, so what actions do we take? Well, actually, you can divide those up in a number of different ways. You'll be familiar with the idea of scopes 1, 2, and 3. Scope 1 emissions are the emissions that you have in your company or your house from burning fossil fuels yourself. So that's the petrol in your car, or the gas in your boiler at home or central heating, or the coal in a fireplace. Or if you're at a factory or a business, it's your gas central heating, it's your combined heat and power plant, it's your petrol vehicles. So number one, you need to get rid of anything that burns a fossil fuel. So get rid of your gas boilers, etc., and electrify. And yes, there will be expense. Yes, it costs a lot more money than running your gas boiler. But do you know what? If you want to survive and you want your children to survive the next decade, and we are talking about that sort of time frame now, if you do want your son to make it to 35, then you and your son have no choice but to spend that money. So let's just get real about this. The economics don't really come into as much if you're really bothered about survival of those you love and of yourself. Scope 2 is the emissions from the power you purchase. So that might be for aircon, or it might be for your electric cooker or your electric car, for instance, or indeed for your computers. So you need to move to a 100% renewable power supplier, whether you're an individual or a company. And certainly in Britain, there are many of those, Good Energy or Octopus Energy, but most countries can find one. If you can't, and you're big enough, you can get something called a power purchase agreement, where essentially you get a bond and you build the wind farm somewhere or the solar plant. And that works out over a 15-year period to give you stable prices that are very, very low indeed, around 4.5 cents per kilowatt hour in Europe for a PPA. Or you stick your solar plants up, or you stick your panels or your wind turbines. That's the bits every company, every individual can do. And at the same time, we can move our finance, because most of the banks we bank with, whether we're companies or individuals, are financing our own death. And there are a few that are not. In Britain, I could name those for you. Cooperative Bank, Nationwide Building Society, Monzo, Tradas do not invest with fossil fuel extraction, and most of the other high street banks do. So we can stop investing in killing ourselves and our children just by moving our finance, and we can move our pension funds and our investments in the same way. And most charities in Britain have done that already. They've divested from fossil fuels. So companies and individuals can do those. Then the big ticket item, though, which is the tricky one, is scope 3. So those are the emissions from everything you procure or everything you procure to happen. So it might be, in my hospital, I get you up for a test. Well, did you really need the test? I'm responsible for the emissions from the machine. I'm responsible for emissions from your car. I'm responsible for all of those things. The kit, I'm responsible for the emissions from the kit that I bought from a company. So we all need to start thinking about our scope 3 emissions. Now at home, that's quite relatively easy, and the same for most companies. It comes down to transport. So can we stop flying? Can we electrify our fleets? Can we walk and cycle, do virtual meetings? It comes down to food. Food is a really big one. you don't have to be puritanical about this, but 27% of global warming potential comes from methane. The bit we've got our hands on is that comes from belching cows, belching lambs and sheep, and fermenting wetlands, and from food transport. So we just moved to a local, seasonal, plant-based diet. I'm not going to use words like vegan and vegetarian. If we all cut down dramatically and move to local, seasonal, and plant-based, we save the transport, the refrigeration, and we save the belching of cattle and so forth. And we can do that at work and at home. But then we've also got to think about the other things we buy. And at home, again, that's, do I really need to buy this thing? Can I make do without that thing? Who's the manufacturer that makes the lowest carbon thing? And of course, in business, talking of your son, that's the really big opportunity. It's the real big one. Because if your son gets together with all the companies he buys from and he sells to and says, look, I'd really like to change this, and gets the other people in his sphere together and say, look, let's not compete on this, let's collaborate. How can we do this? You know, I'm talking to you, Brian, and I'm saying, Brian, I'd really like to change the contract so that when I'm buying from you, you will provide me with zero carbon product. How do you feel about that? You might say, well, this is going to be very expensive. I'm not sure I'd do that. And I say, well, we sort of have to do it, don't we? So how can we make this work? So take a collaborative approach to see whether we can decarbonize supply chains. And that's essentially what we need to do. And then I suppose the final bits are engage with those around us, families, friends, and workforces, to get them to take the same sorts of action. Advertisers tell us we can all change the behaviors of at least 7 people who love us or respect us enough to change. In a workforce, it's the easy win. If you've got employees while you're trying to sort your scope 3 out, it's saying, well, look, can we help you move your electricity supply? We can get you a good deal. Can we help you move your bank? Can we change what we serve in our canteens? Can we help you with the transport, maybe help you to work from home a bit more, and so forth? Can we get you a cycle to work scheme? What are the things we can do with our workforces? So that's a rather long answer, but the answers really, as I've outlined, are the same for individuals as they are for businesses. It's just that the sort of types of project we're engaged with or services are slightly different, that's all.
And the quantum, of course, is different, but it does start with every individual. Pardon me, because I think if the individuals are not convinced, even if the procurement director is not actually convinced, because the finance director is sitting on his shoulder saying, "Excuse me, what do you mean you're buying that? That's far too expensive." But it's going to be for, you know, that's where there's the conflicting pressures, aren't there, within companies? Do you
except
think?
that we all work in medicine. So there isn't a conflicting pressure, because death trumps everything. Death trumps dollars. But for years, dollars have trumped any sort of social consequence. Actually, we are talking about you dying, and me, I'm 62 nearly, and my son who's 18. We're talking about catastrophic, irreversible, exponential function change. And anybody listening to this podcast knows it's happening. Look at the weather for the last few years. Look at the temperatures, look at the rates of ice melt, ice sheet collapse, look at ocean temperatures, look at extreme weather events. And this isn't the new normal. This is the start of a massive exponential function, because we're adding around 8 Hiroshima bombs of energy to our atmosphere every single second now. And 1/5 of that will still be boiling our planet in 33,000 years' time. So we've got to stop right now. So there isn't an excuse to say, oh, we've got conflicting pressures. I'm sorry. It's absolutely unacceptable. It's a bit like me saying, well, I've got conflicting pressures. I've got to feed my family, so I've got to shoot your family. No, that's not a conflicting pressure. We have
I accept that. I mean, you're very powerful in the way, and I'm glad you're presenting very stark facts, which I'm not sure everybody wants to hear, first of all, which is one of the reasons we're doing the podcast, because we've got to get the message out there. And what I will say to you is that I go back to my conflicting thing.
Yeah,
I agree with you. Nothing should trump death. But the reality is, a lot of people think they're going to live for a lot longer, and everybody else will sort things out for them. And I'm just saying that within the companies, within healthcare alone, I've seen situations where someone proposed that they should do something about their data center, for example, use a huge amount of energy. The answer was, we can't afford that. And they say, no, but the finance director was saying, we can't afford not to do it, not just for the planet, but for that we will get a return on this investment. So using the word investment as opposed to spend is always something that finance directors will listen to.
Well, I think that's probably true, but I think it's worth, pointing out, you made a good point. People always think that someone else will solve the problem for them. Well, let me just ask them to reflect on the last 50 years of warnings since the days of Kissinger, the last 165 since John Tyndall warned us about greenhouse gases, since early 1990s, 91, the COP processes. Where are these people that are solving the problem for us? No one has. And we can't sit around waiting for others to do it. We're now in the situation where we need to save ourselves. And I say we can. Now, it's not to say that I don't recognize that businesses have pressures on them. If they say, well, I take that radical action, which means we can't compete, we go bankrupt, who benefits from that? I get that. But that's the reason for taking urgent action and convening. So if anyone who's listening is on a board, the answer is today, right now, put it in the diary and work out who are the people you buy from and work with, who are your competitors. You can quickly get round a table next week, because we don't have time to kick the can down the road, and say, how are we going to solve this? How can we not compete with Brian Enterprises so that Montgomery Enterprises and Brian Enterprises work together to decarbonize? We can compete on product, we can compete on price, we can compete on all sorts of things, but on this we're not going to. Could we get a combined power purchase agreement together? Could we talk to the people making our packaging and say, together, we're really huge, we won't buy from you unless you have decarbonized, because then it gives the incentive for that organization to change. So it has to be collaborative, but it also has to be carrot and stick.
I agree. We're running out of time, as always, with these really, really interesting. And I've learned a lot myself just listening to you. So clearly we'll have to do this again.
I'd love to.
At this point, we'll have to wrap it up. But I think perhaps one of the lessons, if I may suggest to you, we should take out of this is we cannot leave it to others. We get the message. That means you and I cannot leave it to others. So one of the things I will be doing is contacting you immediately after this to talk to you about our own Green Health Initiative, which is aimed specifically at collaboration from the US, Africa, India, Australia, the UK, Europe, etc., to bring people together, because we don't do it together collaboratively, we won't survive.
I totally agree with you, and I will gladly engage in that. What we've got to do, though, is not be, quote, more sustainable, because more sustainable is unsustainable and things stop. It has to be fully sustainable, and we have to get with the science. We're going to punch through 2 degrees by the end of 2028. We're on target, if we keep going as we are, for probably 10, and we trigger a mass extinction event at 5.2. So, and this is soon. So we need to set targets for 0 emissions. They need to be in the very near future. Will that be disruptive and painful? Yes, it will. But together, we've got to do this. So I'm up for it.
All right. We will definitely be in touch. And I hope that, I'm sure the people who listen to this will join us, hopefully, and collaborate with us and actually make a real difference. Thanks very much indeed, Hugh. Thank you.
Thanks very much, Brian. Good to speak to you.
Good to speak to you. Bye-bye.